Today I'm going to be performing a physical assessment. So before coming into the room, I would have performed hand hygiene. And I have my gloves on. And I have my patient up to a good working height for me. And I'm going to go ahead and put down the side rail and introduce myself to them. Hi, I'm Briley. I'm going to be your nurse today. Can you tell me your name, your full name, and date of birth?
Henry Aaron Jebediah Graver III.
And your date of birth, please.
Oh, December 16th, 1942.
Okay, so I'm going to verify that that's correct down here on his band. And can you tell me why you're here?
Well, they said I got something called pneumonia.
It's pronounced pneumonia. But you know where you're at?
Yeah, I'm at the hospital.
Right. Can you tell me around what time it is?
Oh, I'm getting hungry. I'd say it's about noon.
That'd be right. So I'm going to have a nurse friend come in and help me set him up. So while he's up, I'm going to go ahead and listen to these lung sounds. And I need to go under the gown and listen bilaterally. Asking him to take deep breaths. So while we have him up like this, we're gonna go ahead and roll him over on his side so I can assess the skin on his back. I'm gonna go towards Meredith. So now that we have him over on his side, I can tell that he has a pretty bad pressure wound. But other than that, his skin looks good. Looking at the skin on the front of him, I can check his skin turgor by pinching and seeing if there's any tinting. I can also check the capillary refill of his fingernails. And coming down, looking for edema on his lower legs. I'm going to look for any pitting or indentations that are left by my fingers. And then going to check to make sure that he has pedal pulses and they are bilateral. So I would just feel for that. Coming back up here, we do know that he has pneumonia, so I would focus very much on the vital signs like his respiratory rate and his O2 stat, but I'm going to go ahead and listen to his heart right now. So the rhythm sounds regular. And I can tell from his chart that he's on 2 liters of oxygen. So I'd want to check and make sure with his oxygen that it is set to that. And I don't want him to know that I'm checking his respirations. So I could act like I'm doing something else. Where's my watch? Oh, it's on my wrist. So okay, so I listened for 30 seconds. It's about 23 breaths per minute. Normally I would just watch to see the rise and fall of their chest. I'm going to go ahead and do the pulse now. For the heart rate. So I'm gonna say about 86. And then I'm gonna go ahead and move into blood pressure. Also with my vital signs, I need to ask about pain. So are you in any pain today?
No.
No? Okay. And I would also check temperature. So I'm gonna say about 136 over 86. So now to finish up, I'm gonna put the side rail back up and move their bed to the lowest position. Oh, also, vowel sounds. I need to listen for vowel sounds. I'm gonna listen in all 4 quadrants to make sure they are active. And while I'm here, I'm assessing the skin here also and made sure to look under the gown. So now I'm gonna put them back into the lowest position and leave them with their call light in reach.